Coughing is common in tamariki, especially in preschoolers. There are many causes of cough in tamariki. The most common cause of a cough is a viral illness like a cold. Tamariki can have several colds each year. They can keep coughing for 2 to 3 weeks after a cold. If your child has had a daily cough for longer than 4 weeks, see a health professional. Call Healthline on 0800 611 116 or see a health professional if your child with a cold is coughing and is having trouble breathing, or is having trouble speaking, or has noisy breathing. See a health professional urgently if your child has a cough and is under 3 months old, or is struggling to breathe, or can't finish a whole sentence, or is struggling to feed, or you think they've choked on something, or you are worried. Call 111 if your child has a cough and is blue around the mouth, or is unable to breathe, or is hard to wake, or is floppy, or you are worried. Most tamariki who cough with a cold get completely better and don't need medical treatment. But if your child has had a daily cough for longer than 4 weeks, see a health professional.